For all of you who don't know me, I'm Dr. Emma Gladwinfield. I'm a local GP at St James's Medical Practice in Rawtenstall. I'm a mum of 3, parent governor, and I live in Rosendale. And my 10-year-old self can't quite believe that I'm talking at this conference about physical activity, because I hated exercise when I was 10. And it's only in the last sort of 15 years I've seen the light. But why am I here today? I'm here today to hopefully forge a relationship between health and education, which I think is long overdue. It's going to have a lasting positive effect on our children's lives. And over the pandemic, I've been thinking a lot about head teachers. And I think GPs and head teachers, we share a lot of the same skills and we go through a lot of the same things. It must be immensely stressful being a head teacher at times. And like GPs, head teachers and GPs, we get vilified by the press quite often. But also, it's such a position of privilege being a GP and a head teacher in a community. We really are the centre of the community, and we can make a difference on a daily level. I'm sure that we both go to bed at night thinking about the same families, worrying about the same children, thinking, have we done enough to support these families? Do we need to escalate it? It's giving me sleepless nights, and I'm sure it is you. And that pressure is immense. And GPs and head teachers, we must also have those days when we go home and we think we have made a massive difference on a family's life and we've set them on a different path. And then we have those mundane days. For me, it's seeing the coughs, the colds, the tonsillitis, and we're just doing our vocation. And actually, that's more than enough. We have an innate idea of what communities and families need in our area, don't we? And like me, you are probably terrified about the fact that almost a quarter of children leaving Rosendale are classed as obese or overweight. And that was in 2019, 2020. The stats aren't out for this year. I'm not sure that they were even collected due to the pandemic, but I can bet that they're going to be worse. I see a cycle daily of the overweight children with the overweight parents, and the parents are desperate to make changes for their children. They don't know what the barriers are, or they can't get over the barriers without help. And I'm also worried, like you are, about the rising number of children with mental health issues. I'm seeing increased rises of anxiety, depression, behavioural problems, eating disorders, and the children I'm seeing will be children that attend your schools. And I'm also worried that the services that these children need with mental health problems are overstretched and underfunded. And this was prior to the pandemic, and things will just be getting worse. We are facing the same problems. And as I tell my children, a problem shared is a problem solved. And that's why collaboration with health and education, I feel, is the way forward. I'm daily frustrated that I'm seeing people in my consultation room with preventable diseases, things like obesity, diabetes, type 2 diabetes, hypertension, and cardiovascular disease. And preventative medicine is the best medicine. And this is why I'm reaching out to you today. There has never been a better time for us to think about well-being and health as a priority. Let's do it today. I'm pleading to you all. I think today we need to start prioritising active movement in children, increasing that, and let's make a ripple effect in our community. So thank you very much for attending. It means a lot.